Tiliofemoral joint. So there's the three joints of the knee region. Right, so tibiofemoral, right, tibiofemoral, patellofemoral, so that basically it's patella gliding along the anterior aspect of the femoral condyle here, and superior tib fib, tibiofibular joint, which is the small little diarthrodial joint right here. So three joints. So we have to test all three. Of course, what we just did now was palpate in the joint line here. It was primarily a tibiofemoral joint motion. Of course, when I do that flexion extension, and even that little bit of rotation, the patellofemoral joint's going along with it. And I've got my digits right there, so I'm trying to catch the edge of that joint anyway, so I'm actually assessing that a bit as well. Of course, during those four motions, what's this joint doing?
Chilling.
Yeah, not much. Just hanging out, chilling. So it's basically, this is basically just a stabilizer, right? And it has far more importance down here. When we get down to the ankle, you shall see. But in fact, while we're talking about the tibiofemoral joint, what's the analogous joint in the forearm? Your answer. Oh, just jump to the small bone conclusion.
Yeah. I agree.
I concur.
So what is it? Well, let's go back to a simpler question. This bone, this tibia, is analogous to which bone in the forearm?
The ulna.
Radius.
The ulna.
The radius rotates, so
This is why we ask. The way to figure this out is look at the digits. What bone? Here's my first digit. Here's my first digit. What bone is on the first digit sign?
radius?
Ah, and if you follow it straight on up, right? What's on the medial side? Radius, right? So this is what? In the forearm, this tibia is the radius. All right? Well, this depends on which joint you're talking about. All right? Because the thing about the forearm is what? That radius, right, unlike the tibia, is highly mobile. It flops over with this motion of pronation supination, which is a motion that's occurring basically up here at the elbow and across the middle of the forearm. Does that motion occur at the knee? It doesn't. Because what do you have instead? You just have this little bit of rotation. Okay. So, just so you know that the analogous bone here is actually the radius and not what you would have thought is the ulna. You just, you can take a look. So there you go. All right, here we go. Tibiofemoral joint. The first motion is LAD. So we've done LAD before in other joint regions. If you remember the LAD at the elbow, it was what? I was going to stabilize here and pull this way. She was seated. Pull. All right. In this case, I'm going to actually do a intergenu stabilization above her ankles, above her malleoli. Stabilize the femur on the table. Poke her in the eyes, pull. It'll look like this. I'm going to traction your ankle with my knees. Okay, so I'm above her malleoli here with my vastus medialis. If you look at my feet, I'm actually offset. Right? 1 foot forward, 1 foot back. I've got her femur locked on the table. I'm finding the patella, sliding to the inferior pole, looking for those eyes of knee. Here they are. I'm going to hold firmly, I'm going to pull with my knees, and I'm going to spring. These are simply feeling the joint open up. The force is coming with my knees. Spring. Any pain or discomfort? So that's a long axis distraction test for the tibiofemoral joint. Simple enough, right? Let's go. Let's